Step aside, Clara. This is level 1 trauma, not a retirement home. The attending sneered at her robust, heavy-browed face and unkempt natural hair. To him, she was a prehistoric relic. The overhead neon hummed, casting a rhythmic, hypnotic blue glow over the linoleum. Then, the windows rattled. A Black Ops chopper descended, painting the glass with amber dust and grit. A general stepped through the doors, uniform scorched to a charcoal gray, supporting a bleeding operative. The attending moved to intervene, but the general's arm was unyielding. He pushed the doctor aside with steady precision. The general's eyes scanned the sterile room, landing on the woman they dismissed. "I'm not here for your protocols," the general rasped. "I'm here for the surgeon of Fallujah. Move." The air in Trauma Room 4 thickens. It turns to lead. The administrator stands frozen. His mouth hangs open. The transfer papers he just threw at Elena flutter to the tile floor. They look like confetti at a funeral. The general is a mountain of a man. He's covered in the dark slick of field trauma. He ignores the administrator entirely. His eyes are locked on the woman everyone else dismissed as a ghost. Elena does not blink. The quiet grandmother persona shatters. It does not crack. It explodes. The stoop in her shoulders vanishes. She stands tall. She stands like iron. The monitors are screaming now, high-pitched, constant, the sound of a life exiting the body. The general's blood pressure is cratering. 80 over 40, 60 over 30. The numbers on the screen are a countdown. The lead resident steps forward. His hands are shaking. He looks at the gaping wound in the general's side. He looks at the ultrasound. He sees nothing but gray chaos. He is paralyzed. He is a child lost in a storm. Step aside. Elena's voice is not loud. It is a blade. It cuts through the alarms. It cuts through the panic. It is the voice of someone who has spoken over the roar of mortar fire. The resident doesn't move. He can't move. Elena moves for him. She grabs his shoulder. She pivots him out of the way with a single fluid motion. It is clinical. It is absolute. Administrator Miller finally finds his voice. "Elena, stop. You are a clerk. You are not on the surgical rotation. You don't have the credentials for this. Security. I need security in here now." Elena doesn't look at him. She doesn't have time for small men in suits. Scalpel. Now. The scrub nurse hesitates. She looks at Miller. She looks at Elena. She sees something in Elena's eyes that terrifies her more than the administrator's wrath. She hands over the blade. Elena's hands are steady. They are the steadiest things in the room. There is no tremor. There is only purpose. She doesn't wait for a clean field. She doesn't wait for the imaging to clear. She knows this injury. She has seen it in the dust of Iraq. She has seen it 47 times. She knows exactly where the artery has retreated. It is hiding behind the shattered rib. She makes the incision. One stroke. Deep. Precise. Miller is screaming now. He's talking about lawsuits. He's talking about the end of her career. He's reaching for her arm. The general's hand shoots out. It is a bloodied claw. He grabs Miller's tie. He pulls the man's face inches from his own. Let her work. The general's voice is a low growl. It is the sound of a dying lion. Miller turns white. He stops talking. Elena is deep in the wound. She isn't looking at the monitor. She is feeling. Her fingers are her eyes. She is searching for the pulse of a dying vessel. The room is silent except for the rhythmic beeping of the failing heart. Everything depends on this. One moment, one decision, 1 centimeter of movement. The residents watch. They are breathless. They have spent years in textbooks. They have never seen this. They have never seen someone operate by touch alone. There. She finds it. The spurt of hot blood hits her cheek. She doesn't flinch. She clamps the vessel. The sound of the monitor changes. The frantic pace slows. It stabilizes. 100 over 60. The tension in the room snaps like a wire. Elena looks up. Her face is splattered with gore. She looks at the residents. She looks at the nurses. She is no longer the woman who files charts. She is the center of the universe. Massive transfusion protocol. Now, I need 4 units of O negative on the rapid infuser. Someone get me a chest tube, not that one. The large bore. Move. The residents scramble. They don't ask for her credentials. They don't look to Miller for permission. They obey. She is the surgeon of Fallujah. She is back in the light. The administrator backs away. He hits the wall. He looks at the floor. He looks at the papers he threw at her. He realizes he didn't just try to fire a clerk, he tried to stop a legend. Elena ignores him. She is already moving to the next task. The crisis is not over. The theater of chaos has only just begun. But now the theater has a director. She leans into the general's ear. I have you. Rest now. The general's eyes close. He trusts her. He is the only one in the room who truly knows what she is capable of. Elena stands over the table. She is covered in blood. She is exhausted. She is home. The transformation is complete. The hidden elite has been forced into the open. There is no going back to the file room. There is only the work. There is only the blood. There is only the spectacular vindication of a woman they called too old. She looks at the clock. 3 minutes since the doors opened, 3 minutes to change everything. The sirens scream louder now. They are not alone. The sky above the hospital pulses with the rhythmic thrum of rotors. 3 more birds, maybe 4. The radio in the corner crackles with a panicked voice. Multiple trauma, shrapnel, blunt force. The highway collapse was just the beginning. The hospital lights flicker. The backup generators groan. This is the moment a system breaks. Elena stands at the center of the storm. She wipes the general's blood from her brow with a gloved forearm. Her eyes are scanning the room. She is not seeing the walls. She is seeing a grid. Miller is on his phone. He is shouting about bed capacity. He is talking about diversion protocols. Elena ignores the noise. Open the north bay, now. Clear the hallways. We are moving to combat triage. The head of nursing looks at her. We don't have a combat protocol. We have standard intake. Elena's voice drops. It is heavy with the weight of 1,000 battlefields. You do now. She moves. The younger residents follow her like iron filings to a magnet. They don't understand why. They just know that the air around her feels safer. The first gurney bursts through. A young woman, pale, gasping, her chest is rising unevenly, flail chest. Elena doesn't wait for a tray. She grabs a large bore needle from a passing cart, tension pneumothorax. She doesn't use the ultrasound. She doesn't wait for a film. She feels the second intercostal space. She drives the needle home. The hiss of escaping air is the only sound in the room. The patient's eyes snap open. She breathes. Elena is already moving. She doesn't stay for the thanks. Next, the second patient is a mess of mangled limbs and gravel. A resident is trying to apply a standard bandage. He is failing. The blood is winning. Tourniquet, high and tight. Elena grabs a length of tubing. She twists it with a savage efficiency. She knots it. The geyser of red stops. You. Pressure here. Don't move until I tell you. She turns. A third patient is being wheeled in. The monitor is a flat line. No pulse. The paramedics are exhausted. Their compressions are getting shallow. Stop. Elena takes the lead. She climbs onto the gurney as it moves. She doesn't use her palms. She uses the weight of her entire history. Crack. The sound of a rib giving way. The residents wince. Elena doesn't. Adrenaline, 1 milligram. The administrator is watching from the doorway. He's paralyzed. He sees the woman he mocked performing a symphony of survival. She is managing 3 lives at once. She is a blur of blue scrubs and crimson stains. Her hands move. Precise, calculated, perfect. She's working on the third patient's chest while shouting orders for the first. Check the intercostal vessels on the girl in Bay 1. She's oozing. I want a massive transfusion protocol started on the crush injury. Type O-neg, 6 units, now. The residents scramble. They are no longer skeptics. They are disciples. They watch her fingers dance through the wreckage of human bodies. They see her find a bleeder in the dark. They see her tie a suture with one hand while holding a suction tip with the other. It is impossible. It is happening. The hospital system has failed. The power is still surging. The staff is outnumbered, but the casualties are not dying. Elena is the wall. She is the barrier between the screaming sirens and the cold silence of the morgue. 1 life. 2 lives. 3. She steps back for a microsecond. Her lungs burn. The sweat is stinging her eyes. She looks at the residents. They are staring at her in silent awe. The smirks are gone. The arrogance is buried under a layer of shock. Miller is still there. His phone is down. He's looking at Elena as if he has seen a ghost. She isn't a relic. She's the only thing keeping his hospital from becoming a tomb. The general's words echo in the silence of the brief lull. The surgeon of Fallujah. The residents realize it now. They aren't watching a clerk. They are watching a masterclass in the impossible. Elena reaches for a fresh pair of gloves. The snap of the latex is a gunshot in the quiet. Next patient. The chaos outside the trauma bay doors continues to hum, but inside the recovery unit, it is quiet. The only sound is the rhythmic hiss of the general's ventilator. The sharp scent of antiseptic and iron lingers. Elena sits on a small stool. Her hands are resting on her lap. They are clean now, but she can still feel the ghost of the heat, the desert sun, the grit of the sand in her surgical mask. The general stirs. His eyes find hers. He recognizes the look. It is the 1,000-yard stare. He knows she is not in a civilian hospital in the city. She is back there. Elena speaks. Her voice is a low murmur. It is the sound of old parchment being unfolded. I stayed in that file room for 4,382 days. She remembers the count. She remembers every single sunset spent away from a scalpel. She remembers the quiet. She thought the paper would drown out the noise of the convoys. The general reaches out a hand. It is weak. Colonel, you saved 300 lives in that desert. Elena looks at her palms. She doesn't see the lives saved. She sees the one she couldn't reach. She sees the last convoy. The dust was so thick we couldn't see the front of the Humvee. The words flow out, slow, heavy, like oil. We had 42 casualties on the ground. I had been awake for 76 hours, no sleep, only caffeine and the smell of burning rubber. I was the only surgeon left in the sector. She stops. The memory is a physical weight. I saved 41 of them. I worked until my fingers bled into my gloves. I stitched. I clamped. I cauterized. I felt like a god. I thought I could hold back the tide with just my hands. Her voice breaks. The flow of the prose stutters. But the 42nd soldier was my son. The silence in the room becomes absolute. The monitors continue their indifferent beep. I reached him 2 minutes too late, 120 seconds. That was the gap between his life and his death. I had the power to save 41 strangers, but I was powerless to save my own blood. The burden of godhood. That is what they called it in the field, the ability to choose who lives and who dies. After that day, I couldn't carry it anymore. The weight of the scalpel felt like a mountain every time I touched a blade. I felt the heat of that convoy. I smelled the smoke. She looks at the general. I hid in the files because papers don't bleed. Documents don't have mothers. If I made a mistake with a folder, nobody died. I thought if I stayed in the dark, I would never have to play God again. The general's grip on her hand tightens. You were never playing God. Elena, you were just a mother doing her job in hell. Elena doesn't respond. She feels the old guilt. It is a familiar companion. It is the shadow that has followed her through a decade of filing cabinets and fluorescent lights. She thinks of the 3 lives she just saved in the bay. The tension pneumothorax, the flail chest, the mangled limbs. She had tried to bury the surgeon of Fallujah. She had tried to drown her in ink and red tape, but the crisis had ripped the mask away. The general had called her name, and the hands had remembered. They had moved without her permission. They had found the vessels. They had tied the knots. She realized then that the file room was a lie. You can hide from the world, but you cannot hide from the gift or the curse. The guilt is still there. It is a permanent scar on her heart. But as she looks at the general, as she sees his chest rising and falling, she feels a different weight. It is the weight of the lives still to come. The tempo of the room begins to shift. The quiet moment is ending. The door to the recovery unit slides open. Miller is standing there. He's not shouting. He's not holding papers. He looks at her with a mix of fear and profound respect. Elena stands up. The grandmother is gone. The clerk is dead. The surgeon of Fallujah is the only one left. The fluorescent lights of the boardroom are cold. They are sterile. They are a sharp contrast to the heat of the trauma bay. Administrator Miller stands at the head of the mahogany table. His hands are not steady. He looks at the faces of the board of directors. He looks at the general sitting in a wheelchair by the window. Finally, he looks at Elena. She is wearing fresh scrubs. They are dark blue. They are the color of a midnight sky. She does not look like a woman who belongs in a basement. She looks like the foundation of the building. Miller clears his throat. The sound is small. It is weak. I made a grave error. The words are forced out. They are heavy with the weight of his own hubris. I looked at a resume and saw an expiration date. I looked at Elena and saw a relic. I was wrong. We were all wrong. This hospital is standing today because of her. Our mortality rate during the highway crisis was the lowest in the state. 0% loss under her watch. He turns to Elena. His eyes are downcast. I'm sorry. I offer my deepest apologies, not just for the dismissal, but for failing to recognize the brilliance in our own halls. Elena does not smile. She does not need the satisfaction of his shame. She has already moved past him. The general speaks. His voice is a low rumble of thunder. She saved my life in Fallujah. She saved it again yesterday. This woman doesn't just heal bodies, she restores hope. He produces a small wooden box. He places it on the table. It is an official recognition, a mark of service that transcends civilian titles. The chairman of the board stands. Elena. We are restructuring the surgical department, effective immediately. We are creating a new position, Chief of Trauma and Field Medicine. The salary is triple your current rate. The authority is absolute. He pauses. He looks at her with a mix of awe and desperation. Please tell us you aren't going back to the file room. Elena looks at the window. She looks at the helipad where the rotors are starting to spin again. The sound is a calling. I am done with paperwork. The transformation is final. It is absolute. 6 months later. The ER is a different world. The chaos is still there. But it is a structured chaos. It is a symphony. The younger residents move with a new kind of purpose. They don't walk. They glide. Elena stands in the center of the bay. She is watching a first-year resident struggle with a difficult suture. She does not yell. She does not mock. Fingers higher. Feel the tension of the tissue. Don't look at the wound. Look at the life. The resident adjusts. The suture holds. The student looks at Elena with a devotion that borders on worship. The Fallujah protocol is now the standard. Every new hire is trained in her methods, the blind stabilization, the high-speed triage, the calm in the eye of the storm. Her legacy is no longer buried in a folder. It is written in the heartbeats of the patients who leave the hospital on their own 2 feet. The sirens begin to wail in the distance, a multi-car pileup on the interstate. The doors burst open. The rush of cold air hits the room. The residents look to the center of the bay. They look to the woman with the graying hair and the steadiest hands in the city. Elena snaps on a pair of gloves. The sound is a sharp, rhythmic, triumphant. She is no longer too old. She is no longer a clerk. She is the surgeon of Fallujah, and she is exactly where she belongs. The world is loud. The blood is coming, but Elena is ready. What happens next will change the way this city thinks about medicine forever.